a patient's lung cancer was missed because of the inactions of a gastroenterologist. How did this happen? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a medical malpractice attorney practicing law here in the state of Maryland, and I would like to talk with you about a case study that I was reviewing. And what happened in this case study is that a husband was complaining to his wife of serious abdominal pains. Because of the seriousness of the pains, he was rushed to the emergency room. Now, while he was at the emergency room, two doctors saw him, and one of the doctors was a gastroenterologist. X-rays were ordered and a chest X-ray was done. After the chest X-ray was done, the results were noted down by the radiologist, and the results of the findings showed that there was an abnormality in the patient's right lung area. On the top of the right lung, there was an abnormality. The radiologist made sure that this was put in the findings. Well, the gastroenterologist at the emergency room saw the patient and everything, and upon discharge, the patient was ordered to do follow-up with the gastroenterologist. Well, we fast forward a couple of days into the future, and the patient is still having abdominal pains. And he's at the gastroenterologist, and he's complaining about this. And the doctor tells him that if the pains continue and if they continue to get worse, be sure to go and check yourself back into the emergency room. Well, we're going to go about a year and a half into the future, into time. And this time, the patient is at another doctor complaining this time of right arm pain, saying that his arm is really, right arm, the shoulder is really giving him a hard time. Well, a chest X-ray is done, and in this chest X-ray, what they find is a tumor that had developed at the top of the right lung. Now, in a medical malpractice lawsuit, the plaintiff, the person bringing a lawsuit, during discovery, they got that first X-ray. Remember that chest X-ray that was done in the emergency room years earlier? Well, they got that X-ray, and remember, in that X-ray, the radiologist had noted some abnormalities in the X-ray. Well, what happened was the gastroenterologist never looked at the X-ray, never looked at the report, never looked at what the radiologist said. And all of the experts stated that if that doctor would have taken the time and looked at what the radiologist was saying, the patient would have had a really good chance of treatment for the tumor that had already started to grow. Now, I realize that if you're watching this video right now, you have questions and concerns. You're probably watching this video right now because you believe that your doctors made an error in your cancer diagnosis. You may believe that your doctors did not take the right actions in your case. Well, if you have these questions and you have these concerns, this is what I invite you to do if your matter happened here in Maryland. Go ahead and pick up the phone and give me a call. It costs you absolutely nothing to call me. You can reach me at 301-850-4832, or if you prefer, send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice questions like yours all the time, and I will be glad to listen to your story. All right, guys, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the medical malpractice attorneys here at Boston Law Group, LLC, and we will see you next time. Guys, take care and enjoy the rest of your day.